Welcome to Senior Health Video. In this video, we will reveal the hidden signs of blood cancer that doctors will never mention. Have you or someone you love been feeling off lately? Maybe it's a fatigue that just won't go away, a cough that lingers with no clear cause, or maybe it's something smaller, a few pounds lost without trying, a night of cold sweats here and there. It's easy to brush these things off, to chalk them up to stress, or aging, or the weather. But what if those little signs were your body screaming for help? Every single day in the United States, someone dies from a blood cancer they never saw coming. Leukemia, lymphoma, myeloma. These names sound distant, like something that happens to someone else, until it doesn't, until it's your father, your sister, your own reflection in the mirror. The scary truth is this: blood cancer doesn't always show up with bold symptoms. It doesn't always knock loudly. Sometimes it whispers, sometimes it hides, and sometimes it waits until it's too late. But it doesn't have to be that way. Not anymore. Because today you're about to learn how to spot the warning signs before they become emergencies. Backed by real science, real stories, and real hope, these 6 early symptoms may seem subtle, but they can speak volumes. And catching them early could be the difference between a life saved and a life lost. So if you've ever had a nagging feeling that something wasn't right, if your body's been trying to tell you something but you weren't sure what, stay with us, because what you'll hear next might just be the most important health message of your life. Number 1, a persistent cough or chest pain. It starts quietly, a dry cough that lingers, a strange tightness in your chest that doesn't quite go away. You tell yourself it's allergies. Maybe the air is dry. Maybe it's just age catching up. But what if that harmless cough is actually a warning from deep inside your body? Blood cancers like lymphoma and leukemia can trigger chronic coughing or chest discomfort. Not because the lungs are sick themselves, but because of something more hidden. As cancerous white blood cells multiply uncontrollably, they can enlarge the lymph nodes inside your chest. These swollen nodes press on your airways or lungs. Result that stubborn cough, that weird chest pain. No cold, no fever. But your body knows something is wrong. A study published in Pediatric Surgery revealed that many cases of leukemia in adults present with unexplained chest discomfort as one of the first signs. Not sharp pain, not breath-stealing agony, but a dull pressure. An irritation that feels like it shouldn't be there. It's even more deceptive because this symptom often shows up in people who don't smoke, who don't have asthma, who are otherwise healthy. That's what makes it so easy to ignore, so easy to misread. So what should you do if a cough lasts more than 3 weeks? If it keeps you up at night? If chest pressure seems out of place? Do not wait. Ask your doctor for a chest x-ray, a CBC test. Even if it's nothing serious, you've ruled out something deadly. A retired school teacher in Ohio ignored her cough for 2 months. It was only after it started waking her up at night that she saw a doctor. That cough saved her life. It led to an early lymphoma diagnosis, and treatment began immediately. But just knowing this isn't enough, because what comes next is even more dangerous. Number 2, frequent infections that just keep coming back. If a lingering cough can be a silent scream from your chest, then repeat infections are your immune system waving a white flag, a sore throat that keeps returning. Sinus infections that drag on for weeks. UTIs that seem to bounce back every month. These are not just bad luck. They may be early cries for help from your blood. Blood cancers quietly attack the immune system long before they show up on scans or blood work. Cancers like leukemia and lymphoma disrupt the production of healthy white blood cells. These are your body's frontline defenders. Without them, your immune army weakens and everyday bugs become long battles. According to research published in Hematologica and Annals of Medicine and Surgery in 2023, repeated infections are one of the most common early signs of chronic lymphocytic leukemia. Patients reported being prescribed antibiotics over and over with no lasting relief. And this pattern often appeared months before a diagnosis was ever made. So how do you spot the red flags if you're catching colds more often than usual? If fevers come and go with no clear reason? If infections last longer or hit harder than they used to? Do not ignore it. A simple, complete blood count test can reveal if your immune cells are being crowded out by something more dangerous. One retired pilot in Florida kept getting bronchitis every other month. His doctor finally ran a full blood panel. That test revealed early-stage leukemia. Because they caught it early, his treatment was short and successful. But just knowing this isn't enough because the next sign hides even deeper. Number 3, fevers or chills that appear without a cause. If repeated infections are the sirens of a struggling immune system, then unexplained fevers and chills are the flames it can no longer contain. You wake up sweating through the sheets. You feel cold even under a blanket. Then hours later, you're burning up. No flu, no infection, just waves of heat and shivers you can't explain. This could be your body fighting a silent war inside your blood. In many types of blood cancer, like leukemia and lymphoma, the immune system becomes so disrupted it sends false alarms. The result, random fevers and sudden chills that come and go without warning. Studies from Infections in Hematology and Curious Journal highlight that up to 90% of leukemia patients reported recurring fevers as one of their earliest symptoms. Not high fevers, not hospital-level emergencies, just low-grade temperature spikes that seem to have no source. That's what makes them so easy to overlook. It's also not about how high your temperature goes. It's about how often it shows up and how strange it feels. If you're noticing fevers with no cold, chills with no flu, or sweating at night without reason, it's time to get curious instead of dismissing it. Doctors recommend tracking your temperature daily if this keeps happening. A pattern of unprovoked spikes could prompt early testing, like a CBC or bone marrow biopsy. And in many cases, early detection leads to easier treatment and higher survival rates. A 63-year-old woman in Michigan began keeping a journal of her night sweats. It helped her doctor connect the dots and diagnose lymphoma before it spread. That notebook gave her a second chance. But just knowing this isn't enough because what comes next is far more visible, yet just as dangerous. Number 4, unexplained bruising or bleeding. If night sweats and fevers are invisible signs of an inner storm, then unexplained bruising is when that storm finally starts to show on the surface. You bump your arm lightly and wake up with a dark purple bruise. You notice blood on your toothbrush or nosebleeds that happen out of nowhere. At first it seems minor, but your body may be warning you of something much deeper. Blood cancers interfere with the bone marrow's ability to produce platelets, and platelets are the tiny cells that help your blood clot. Without enough of them, even small scrapes can bleed longer. Even gentle touches can leave marks. It's not just about one bruise, it's about how often they happen and how little it takes for them to appear. According to a 2023 report in BMC Cancer, there's a strong connection between early-stage leukemia and frequent skin bruising in people over 50. These are not injuries from trauma. These are signs of low platelet counts caused by malfunctioning blood production. One key detail: the bruises often appear in odd places, your back, your stomach, or you see petechiae, those tiny red or purple dots that look like a rash but don't fade when pressed. These aren't skin issues. They're internal leaks from weakened blood vessels. So what should you do? Take photos of the bruises, track them. Show your doctor if they appear repeatedly or without cause. A simple platelet count test could reveal problems before they escalate. A 68-year-old man in Texas noticed a bruise on his thigh the size of a grapefruit. No memory of injury. That bruise led to early diagnosis and remission from acute leukemia. Sometimes what you see on the outside saves what's happening on the inside. But just knowing this isn't enough because the next symptom may feel harmless at first, until it drains your life without a sound. Number 5, persistent, itchy skin with no rash. If bruising is what your body shows you, then itching is what it whispers when something's wrong beneath the surface. Not the kind you get from dry weather or a bug bite. This is deeper, more relentless. Itchy skin with no clear cause can be one of the earliest and strangest signs of blood cancer. In particular, lymphoma is known to trigger persistent itching long before more visible symptoms appear. Why? As abnormal white blood cells multiply, they release proteins and inflammatory chemicals into the bloodstream. These substances irritate nerve endings in the skin, causing an itch that lotion cannot fix. A 2019 study in dermatologic therapy found that nearly 30% of Hodgkin lymphoma patients reported unexplained itching as a primary symptom. Not just on the arms or legs, sometimes across the back or even the scalp. It often happens at night, and it doesn't respond to antihistamines. It's not the skin that's sick, it's the blood. This kind of itch is more than annoying. It affects sleep, it changes mood, and it lingers. If you've had an itch that lasts for weeks with no rash, no allergy, no dryness, it's time to take it seriously. Doctors recommend tracking how long the itch lasts and where it occurs. Blood tests can check for markers of inflammation or abnormal lymphocytes. Catching this signal early can lead to a diagnosis before the disease spreads. A woman in her early 60s from Oregon said her skin felt like it was crawling every night. No rash. Just a feeling she couldn't shake. Her persistence led to early-stage lymphoma detection, and that persistence saved her life. But just knowing this isn't enough, because the next warning sign doesn't just affect your comfort, it can take away your energy to live. Number 6, fatigue that feels bone deep and never goes away. If itchy skin steals your comfort, this next symptom steals your strength. It's not regular tiredness. It's not feeling a little groggy after a long day. This is the kind of exhaustion that sticks to your bones, the kind that makes getting out of bed feel like climbing a mountain. And no matter how much you rest, you never feel restored. Fatigue is one of the most common and yet most overlooked signs of blood cancer. That's because it's so easy to blame on other things: poor sleep, work stress, age. But this is different. When your blood is sick, your oxygen delivery breaks down. Cancer in the bone marrow slows or blocks the production of red blood cells. That leads to anemia. And anemia means your body is starving for oxygen even when you're breathing fine. A 2023 study published in Scientific Reports found that over 40% of blood cancer patients listed extreme fatigue as their first major symptom. But it often gets ignored until daily life becomes a struggle, until a short walk feels like a marathon, until people around you notice you're not yourself. So what can you do if you've been feeling tired for more than 2 weeks and rest doesn't help? If small tasks wear you out? If you need naps just to get through the day? Ask your doctor for a CBC test to check for anemia and abnormal cell counts. It's simple, it's fast, and it could save your life. A retired nurse in Arizona pushed through 6 weeks of exhaustion thinking it was stress. A routine blood test told a different story. She was diagnosed with early-stage myeloma and started treatment immediately. That test gave her years back she might not have had. But just knowing this isn't enough, because what you do with that knowledge next is what really counts. So now you know the 6 early signs of blood cancer that most people miss. A cough that never leaves. Infections that keep coming back. Strange fevers and chills. Bruises that appear without cause. Itchy skin that will not quit. And a deep fatigue that feels like it owns you. Each one might seem small on its own, but together they could be your body's way of saying, please pay attention. The truth is, early detection can change everything. It can mean shorter treatment, higher success rates, more birthdays with the people you love. That is why recognizing these signs and acting early is not just smart. It can be life-saving. If even one of these symptoms sounds familiar, do not ignore it. Talk to your doctor, ask for a complete blood count, keep a journal, share what you feel. These steps are small but powerful. You do not have to wait until something becomes severe to take action. You deserve answers. You deserve peace of mind. And most of all, you deserve a life filled with energy and confidence in your health. We believe that knowledge is the first step to healing. And now you have it. In our next video, we will be talking about the top foods that naturally support blood health and energy after age 60. You will not want to miss it. So if this video helped you even a little, please save it, share it with someone you love, and subscribe to the channel for more trusted health tips made for your life stage. Your journey to better health starts now, and we are honored to walk it with you.